Hi, so our presentation is on the human papillomavirus, which is also commonly known as HPV. What is HPV? It is one of the most common sexually transmitted infections. It is transmitted through genital or skin-to-skin contact, and those who have sex at an early age and or have many sexual partners are more likely to get HPV. Signs and symptoms. If you have highly contagious genital warts, rough and raised warts on the fingers, hands, or elbow, plantar warts on the heels or balls of your feet, flat warts on legs or the chin, or itching of the genital area, you may have HPV. Classification of HPV. So it belongs to the human papillomas virus family. There are more than 200 types of viruses within this family, and they include non-enveloped double-stranded circular DNA viruses that infect the skin and mucosa. This kind of virus is tissue species specific, so really only mammals and reptiles can develop this virus. The human papilloma virus will enter the host cell and bring its DNA to the nucleus, and the two most common HPV strains are HPV 16 and HPV 18. How HPV 16 enters into its host cells. So the virus enters through damaged epithelial tissue. It will bind between viral L1 protein and heparan sulfate protoglycan on the membrane, which are receptors. Se- those receptors in the ligand will go through several conformational changes through proteases and chaperonins. The virus will then undergo endocytosis and will continue with intracellular trafficking, so it can cross the Golgi complex and the endoplasmic reticulum. Once it gets past there, it will be able to enter the nucleus and replicate itself. The host cell is now infected with the virus's DNA and will cause the virus to continue spreading.
All right, so now we're going to look at why HPV is such an important virus to know about. So, it is extremely contractable around the world and in the US. So, it is the most commonly diagnosed STD, and it spreads very easily, especially among young adults, which is why you have to get vaccinated before you can come on a college campus. Most so almost everybody would be infected with HPV at some point without vaccination prevention methods. And then for some numbers, 42 million people are currently infected in the US today, and 13 million people are being diagnosed each year. So there are future complications that can come with an HPV infection. Um, Although you may not think that the symptoms are too bad at first, it is the leading cause of cervical cancer for women. And then it can also cause other forms of cancer that can't be screened as early as cervical cancer. So they will likely develop farther than that and become more difficult to get rid of and much more dangerous. So these other areas are the anus, vagina, vulva, penis, and even the throat and tonsils.
Next, we'll talk about the treatments and the side effects. So, for treatments, there are no one cure or specific treatment for HPV that overall solves it all, but there are treatments to help with the ailments from the virus, such as the warts and cancer and that sort of thing. So, for starters, there is a vaccine, which isn't a treatment, but it is a preventative measure against getting the virus. So, it prevents most of these symptoms if someone were to get the virus or helps stop spread the virus. And the recommended age for administration is between the ages of 11 to 12. So it's likely before any of them get the virus, it's preventative. Next, there are treatments for cancer that come from the HPV. and it is treated separately and it's just treated as cancer. So with radiation, chemo, that sort of thing. And there is a cervical precancer that can be diagnosed when it is known that someone has HPV to help prevent it from metastasizing or going into the further stages and can be treated easier. And there are also topicals that can be used from the warts that are generated from the HPV virus. There is an over the counter version called salicylic acid, which we'll talk about the biochemistry of more in a second. And then there are also 3 prescription drugs, which are Imiquad, Podophylax, and trichloroacetic acid, which are very similar to salicylic acid, but they are prescription only. So then going into the biochemistry of salicylic acid, it is a topical treatment, and along with the other ones, it selectively causes damage to the infected cells from HPV. And it is also a keratolytic agent, which means that it causes the skin of the warts to shed and pretty much fall off, which helps get rid of them. The exact method of how it works is unknown, but it is believed that it reduces the cohesion between the corneocytes, which have to do with the keratin in the cells that keep it strong in the skin. And then once this happens, it leads to the shedding of the epithelial cells, so then the skin falls off and it becomes smooth and there's no more wart after. And for the side effects from these treatments, for topical treatments, it can cause skin irritation and redness, along with swelling, burning, and itching, likely due to the normal cells and healthy cells around it to be affected by the treatment as well. And then for the vaccine, it is a normal side effect of most vaccines where there's like pain at the site of injection, fever, dizziness, nausea, headache, and then muscle or joint pain, which are all caused due to the new antibodies forming and the body trying to fight off the disease before it can form the antibodies and before immunity is made.
How the vaccine works. The vaccine is similar to other vaccines. It stimulates the body to create antibodies that will be able to bind to the virus once it is in the body. The vaccine is able to prevent future infections, but it cannot get rid of current infections that are in the body. And the current vaccine is based on virus-like particles, or VLPs. Virus-like particles are molecules that mimic the virus. They are not infectious. They are safe for autoimmune compromised individuals, and they have no risk of mutation because there is a lack of genetic material in the virus, which makes them not infectious. The history of HPV. HPV was discovered in the 1980s by scientist Harold zur Halsen. During his research, he was able to draw connections directly between HPV disease and cervical cancer in women. Zur Halsen was able to find 2 new tumorigenic strands of HPV. These strands are HPV 16 and HPV 18. And the 2 strands have been found in 70% of cervical cancers.